Hair loss has become such a notorious problem amongst all age groups. Whether you're a male or a female, it has truly become a very rampant problem, and now the more we're progressing into time, more hair loss we're seeing. A common question we're observing from all age groups is, when is the right time to get a hair transplant? I'm Dr. Anika Goel, Chief Consultant, Dermatologist and Hair Transplant Surgeon at Soul Derma Clinic, New Delhi. And today I'm going to be telling you about the right age to get a hair transplant. To give you the correct answer for this, we first have to understand what kind of age groups we're seeing hair loss in. Unfortunately, with time, I'm seeing younger and younger people with hair loss ranging anywhere from 17 or 18 years of age up to 60s and 70s. So how do we decide when is the right time for a transplant? You need to understand what hair loss is first to decide which age we need to combat it at. Hair loss or hair thinning is a genetic problem. Because of the DHT present for males, there is thinning of the hair, and in women, estrogen. So this thinning will only get worse with time, and then other factors like nutrition, like lifestyle, will also contribute to the thinning of the hair. So you have to realize that as we progress in age, the hair thinning usually does progress too. So to answer the question, there's no absolute right age. I would definitely request and recommend that my younger patients that are anywhere between 18 to 23 definitely hold off before considering a hair transplant. Please first talk with your doctor. You need to talk about medications like Minoxidil, like Finasteride, like multivitamins, and even in-clinic procedures like GFCs and mesotherapies and so forth. And then after you've undergone all of those options, you can think about a transplant. So if I have to recommend the procedure, I would look at the grade of baldness first. If there's significant thinning, then maybe in your mid to late 20s onwards, you can think about a transplant. I also have patients these days who request for a transplant saying that they don't want people to realize they've ever lost any hair. So it'll look like a natural progression that the hair starts thinning, we do a transplant, and we try to preserve the hair that is there. If some more thinning happens in the future, then that person can always opt for a second session of transplant. So there are two types of patients we will always see: the ones that are maybe significantly bald and then we opt for the transplant, or it may be the other way around, that at an earlier stage you choose a transplant so that you can kind of gracefully, smoothly transition without anyone ever realizing you've even had a transplant done. Hair thinning and hair loss has become such a major problem right now, but I urge you to consult with your doctor and figure out what the right treatment is for you at the right age of your life. If you found this video helpful and informative, share it with your friends and family, whoever would benefit from this. You can comment down below for any further questions, like the video, and subscribe to my channel.